We're going to talk about the difference between a major depressive disorder and a major depressive episode. Now, an episode, as it states right here, is 2 weeks. That's why it's circled in blue. 2 weeks. That's an episode. A disorder is the next step from there. It's two or more major depressive episodes with at least a consecutive 2-month interval. So we got 2 months here. But what we're going to do is we're going to fill in all the blanks. You've got a guy here, a girl, feeling guilt, feeling guilty, I feel worthless, I can't think, things like that. So they have a problem with their self-worth, or they can have a problem concentrating. So a patient comes in the office, they say they feel worthless, they can't think, they feel guilty about things. There's the saggy closes, unintentional weight loss. Could be also weight gain. This right here is a baseball with, webs on it. Loss or decreased interest in activities. This right here is this tapping of the foot. We've got psychomotor agitation or retardation. You've got now this whole, arrow going down is this depressed mood most of the day, nearly every day. That's the check marks. So the one big thing, the difference between the major depressive disorder or major depressive episode and dysthymic disorder is when you're in a major depressive, you think about death a lot. So if any question comes up that, that not preoccupied with death, then you might want to look at dysthymic disorder, which we'll go over a little later. But so you got a little, and you got the little grass here. So thoughts of death. Things like, I'd be better off dead. Oh gosh, I think it would be greater. Things like that. Those are some of those episodes or symptoms. So in order to have an episode, you have to have five symptoms. So let's kind of look at these. Could be 1 symptom, 2 symptoms, 3 symptoms, 4 symptoms. Feeling worthless, not able to sleep, feeling guilty, not able to sleep. Here's one right over here. It's up at nighttime. So you want to have at least 5 of these symptoms. Now, the disorder is if you've had this for 2 months. You've had 2 or more major depressive episodes with at least a consecutive 2-month interval between them. So it's just a matter of labeling. If you see a question that talks about somebody that's just feeling worthless, they're losing or gaining weight, they can't sleep, they start thinking about death, and this has been going on for months and months, and they've had at least 3 or 4 of these, episodes, then you can give them this, disorder diagnosis. Okay, so treatment, hospitalization might be required. Antidepressant therapy usually started, and like the SSRIs are best due to be safer in case of overdose. Now here's these SSRIs right here. Don't you recognize them? We have got the fluoxetine, the flying ox, and its twin, fluvoxetine. So you got fluoxetine and fluvoxamine. Sorry, this is fluvoxamine. It's got an M. Okay. Then you've got, whoops, forgot the. You've got the pair of oxes, or the paroxetine. And right here you've got the Sir Trey line standing out. Sir Trey standing on the line. See, he looks like a guy. Sir Trey. Sir Trey Lean. Standing on the line. He must be going through a sobriety test or something. And then you've got the prams. Now, pram, if you didn't know, is an English or British word for a baby carriage. So you've got the prams. You've got citalopram or citalopram. So you've got cities pram, C-I-T-A, citalopram, or escitalopram. So you've got all the SSRIs that might show up on the test. You've also got all the other things that have to do with either a major depressive disorder or major depressive episode. Remember the difference between the two.